Everyone. My name is Dennis King. I'm the chairman of the Housing and Planning Scrutiny Select Committee. For the benefit of those watching on our YouTube channel, members of the committee are present in the chamber, and these members will be voting on the proposals this evening. Other members of the council are also in attendance and/or participating via MS Teams and can take part in any discussions, ask questions, but they are unable to vote. Your attention is drawn to agenda item 1, which sets out the guidance on how meetings will be conducted, including the ground rules that apply. Before we start with the formal business, we'll confirm the attendance of voting members by doing so via a roll call. Victoria, would you like to introduce yourself and do the member roll call, please?
Thank you. Victoria Freeman, Democratic Services. Councillor King.
Present.
Councillor Bell.
Present.
Councillor Bridge.
Present.
Councillor Brown.
Present.
Councillor Dalton.
Present.
Councillor Davis.
Present.
Councillor Hickmott.
Present.
Councillor Hood.
Present.
Councillor Pilgrim.
Present.
Councillor Palmer.
Present.
Apology been received from Councillor Rowd, who's been. Apologies been received from Councillor Tanner, who's been substituted by Councillor Williams.
Present.
Councillor Thornywell.
Thank you. I'm now going to ask the officers to introduce themselves. I'm going to start with Linda, working towards me and past me. Thank you.
Hi everyone, Linda Hibbs, Head of Housing and Regulatory Services.
Good evening, members. Eleanor Hoyle, Director of Planning, Housing and Regulatory Services.
Evening, members. James Bailey, Head of Planning.
Thank you. Members, we do have two guests this evening. That is Donna and Annette. I'm going to ask to introduce themselves, and we will come back to their presentation at agenda item 6. So, Donna. Donna, there's a mic in front. You have to press the button.
Hi, I'm Donna Ward. I'm an operations manager for Town and Country Housing for the Home Improvement Agency section, and we help deliver disabled facilities grants and various other services across Kent and East Sussex.
Evening, I'm Annette. I'm the Handyperson Team Manager, which is one of the services that we deliver within the Home Improvement.
Thank you. I am somewhat remiss. I did overlook Kelly online, and she's last but not least. So, Kelly, can you just introduce yourself, please?
Yeah, sure. Good evening, members. Kelly Sharp, I'm the Planning Policy Manager.
Thank you. Moving on, we've covered apologies to absence, which we have Councillor Tanner being substituted by Councillor Williams and Councillor Rowd being substituted by Councillor Hoskins. Thank you for coming. So in saying that, we've covered the substitute members. I'd like to know if there are any declarations of interest to be stated, please. I see none. Thank you very much. Agenda item 5, we have the minutes of the ordinary and extraordinary meeting held on the 17th of March 2026, and they are attached at pages 13 to 20. I would seek your agreement that they are a correct record. Thank you. Right, here we come to the two ladies that kindly come along this evening. It's Donna and Annette. They're going to explain to us how the Home Improvement Agency works, what it does, and all the benefits that come with it. So over to you, ladies. Thank you.
Thank you, and thanks for inviting us along this evening. So I will take the first section and give you a bit of an overview around what we do. So our priority is about keeping the residents to stay at home for as long as possible. Adaptations be they major or minor, so that people can enjoy the comfort of their own home. Well done. So each year, the government budget allocation through the Better Care gets allocated down local. Am I? Sorry. I'll do my best. Thank you. Sorry. Yes, so the government issues allocations each year. They get sent down to district and borough level, and they are for people to access, eligible people to have adaptations done to their home. The adaptations can include extensions for extra rooms, bathing and washing facilities, stair lifts, roof floor lifts, ramping, door widening, kitchen adaptations, etc. In 26-27, the budget for Tunbridge and Moorland area is 1.6 million. Town and Country Housing work in partnership with Tunbridge and Moorland Borough Council to help deliver the budget for eligible customers. We, on average, have helped around 88 people adapt their home per year over the last 3 years, with an average cost of works running out at around £10,416. And we assist children and adults. Just to give you some sort of comparisons, during April 25 to March 26, we completed 55 grants, which were at a value of less than 10,000, 21 between 10 and 20,000, and 6 that were between 20 and 30,000, and 4 were above 30,000. The grant maximum limit is 30,000, but through changes through housing assistance policies, some districts and boroughs have provision to allow people to either have 2 grants or to top a grant up, or some customers may have the means to be able to go higher. You can understand if it's something like an extension or an additional room being built, £30,000 doesn't really go too far when you're looking at the wider scope of work. Some of the ages of the customers dealt with, we're seeing sort of younger people more so now coming through. In 2023-24, the average age of a customer was 61 years, and the youngest we helped was just 5 years old, with the oldest being 94. In the year 24-25, they were 62 years old was our average age. And again, our youngest was a young child of 6, and our eldest someone of 95. And in 25-26, our average age was 50 years old for a customer coming through, with the youngest being 6 and the eldest 102. And so you can see we go right across the sort of span of ages. We do go out to our customers at the end of completed projects and seek feedback. It isn't every customer that returns a survey or clicks the link to provide feedback, but when they do, we do appreciate what people have to say, both good and bad. And up there, you'll just see a selection of some of the feedback that people have written into us around the service. And I thought it would be useful to sort of demonstrate, you know, that it's quite life-changing to have an adaptation, enabling you to sort of live in the comfort of your own home. I won't read them out, but you can see for yourself up there. Thank you. The outcomes that are reported to us through our surveying our customers are that it does enable people to stay in their own home and or increase their independence. It helps to reduce the risk of falls and injuries. Quite often we find, especially with older housing stock as well, people tend to have baths in their home and they can't manage getting in and out of the bath, and it does create falls, and therefore that's a lot of our adaptations are through bathroom adaptations, putting in flush floor showers or wet rooms, and they help to feel safer at home, and it supports their health and well-being generally. This is a case study that I thought would be quite useful to demonstrate what happens. So the referral was for an application for a disabled facilities grant to convert the existing garage into a flush floor shower and improve the rear property access due to significant health issues. Mr. X was unable to leave the house without hospital transport, and Mrs. X could no longer manage his care without the adaptations being carried out. Tunbridge and Moreland Council requested us to carry out a provisional test of resources to determine their grant eligibility. This is a means test, basically, to understand what income and savings they've got to understand whether they are eligible for a grant. This particular customer was receiving a guaranteed pension credit, which is a passporting benefit that makes them entitled to the grant. The occupational therapist requested a feasibility visit with our surveyor for some support and guidance to help develop the recommendations to do an adaptation at this home. And it resulted in a comprehensive set of recommendations for a complex adaptation scheme. The total cost of works was estimated to be around £44,675, exceeding the upper grant limit I mentioned earlier of £30,000. Of course, there was a shortfall of about £14,000. Mrs. X confirmed that they lacked the savings to cover the difference. The caseworker from our office explored with them possible charitable funding options and learnt that previously I spotted my faux pas. Mr. X, not L, had previously served in the armed forces. She then went to, with their consent, she approached the armed forces, the SAFA organisation, to see if they could assist with a top-up of funding. At the time, they could not assign their own caseworker, and so our caseworker supported directly and provided all of the required information. The customer at the time was in hospital, and until this work was done, he really could not be charged home safely. The outcome was that SAFA successfully coordinated with affiliated charities and secured the additional funding of the £14,000 required. The application was submitted and approved, works were completed, and the gentleman was discharged home safely. Over the course of time, the Better Care Fund has grown significantly, the pot of money available. And back in about 2016, I think it may have been, we went around to some of the districts and boroughs, and Tunbridge and Moreland actually was one of the first ones we approached around sort of the discretion of using Better Care Fund allocations a little bit differently. There's always been a lot of pressure on hospital discharge and, dare I say it, bed blocking and the need to get people out quicker. So funding is received in partnership with other local authorities and district councils around, where we have a health and housing discharge service. We have Sue Marshall and Georgina Caradas, Sue based at Maidstone and Georgina at Tunbridge Wells Hospital. They're directly employed by us, but they're funded between Tunbridge and Moreland, Tunbridge Wells and Sevenoaks Council. They work with the hospital discharge teams to support and speed up the discharge pathway where a patient has a housing related issue that is the cause of the delay. This service is tenure neutral. It could be something as simple as the patient being brought in by an ambulance who had to actually physically break the door in to get in to bring the person home to hospital, and therefore the house isn't secure. It could be whilst they were there collecting the patient, they've noted quite significant risks in the home, hoarding, clutter. It could be as simple as they need to go home, but some low-level grab rails situated around the home to help them navigate stairs and things like this could support. So often we carry out home safety visits, assessing any potential works needed to ensure a safe discharge and a discharge that brings that patient home, but enables them to stay at home rather than being back on the revolving door of going into an acute setting again. And it directly links to our home enablement service, which is supported by our handy persons, and our home straight service, which is another service we set up directly supporting customers with hoarding and clutter tendencies. So in 25-26, we assisted 89 patients to go home safely from an acute setting. 55 people living in the community were supported to stay living in the community. So if someone's in the community and they're receiving a community-based service or perhaps a district nurse visiting, and they are spotting something that if it isn't addressed could potentially send that customer for a stay in hospital, they can refer in to have that item fixed or resolved. 13 patients were discharged safely from a cottage hospital or a step-down bed facility. And the average cost to support each patient is about £192 during the year of 25-26. I don't know what the latest figure is. Forgive me, I probably should have background checked, but you know, a few years ago, they used to estimate a hospital bed per night as being about £350. So you can see that every night we bring someone out of hospital successfully and quicker, we're making a saving there directly to the NHS. And this was a case study from one of our ladies that done some hospital discharge work. It was for clearance in a home that was quite severely cluttered and the creation of a micro environment. This would be where someone, their normal sleeping quarters would be upstairs, but for whatever reason, going home, the stairs are going to be a challenge. And therefore, the answer would be to bring a bed downstairs, create a micro living environment in a downstairs space where they can manage short term until they're rehabilitated enough to go back upstairs. This patient had previously been referred over a year ago to the Health and Housing Service for a previous declutter and safe pathways. But after acquiring a quotation for the work, they had declined the work. The patient was now in a self-funded step-down bed, having had a stroke and needed a hospital bed at home, a hoist and other equipment to allow her to go home safely. The challenge was that the clutter rating, so we use a clutter image rating scale that's been developed by the fire brigade, and they were an 8, number 9 being the highest. There were dangerous electrics there. The oven had been condemned by Kent Fire and Rescue. Lots of extension leads under rubbish on the floors, which were a fire hazard. Main bedroom was cluttered, mattress on the floor and a nest of blankets where the patient slept. Steep stairs with twists and turns, lots of clutter, no central heating, no safe pathways. The front access to the property was blocked by overgrown foliage and the patient was reliant on candles around the home. So the challenge was that obviously the property was not really safe to return to in its current state. The patient had the capacity to decide to return. She had 2 children and had an estranged relationship with both, a son who is a consultant with the NHS and a daughter who is a nurse in London. The patient didn't receive any welfare benefits and funding to get the house cleared and in a safe condition for the return really was reliant on the patient and or family. 85 years old and potentially could stay in long-term care. Looking at the scale of the property. Outcomes: environmental health officer visited from Tunbridge and Moreland Council to assess and establish possible funding and grants available to help expedite her discharge. An agreement was reached for a 3,000 maximum grant with any additional cost being met privately. 2 quotes for the work were sought and a grant application made. This was presented to Social Services Officer who was mediating between the patient and her children due to the estrangement. The daughter stepped in and started to oversee the clearance of the items to save money, and a private agreement was made with the chosen contractor for the funding and the work to go ahead. So she did return home, and I think the relationships are tentatively being rebuilt there. And over to briefly explain our other services.
So I'm just going to go on to explain some of the other services that we've got. So we've got the Handy Person Home Enablement Service. So this helps support the health and housing coordinators that I was just explained to you. Again, this is funded through the Better Care Fund and allocated between the Tunbridge and Moreland, Tunbridge Wells and 7 councils. and it supports the help with the hospital discharge. So the handy persons are there then to go out and support at the home by doing things like the handrails, installing key safes so that carers can access the property. We do a lot of micro environments so that people, if they've got to have downstairs living, we might again be supported with the sort of safe pathways to make sure it is safe for them to go home, lock changes, especially if fire brigade and things have been involved in gaining access. So that's just to name a few of the bits that the handy person service supports. And again, they come in from health and social care professionals. And again, some of it will come in through the community as well. So again, if there are district nurses out, social care are involved with families, then they will refer in as well. So over the last year of 25 to 26, we visited 148 homes, completing 195 tasks whilst there. 61% of that promoted the hospital discharge. That was people that are actually already in hospital to get them home quicker. And 29% of the jobs helped sort of potential unplanned admissions. So those people that are at home in the community that oh, hey then. Okay. 31% of the jobs were two-men jobs and 69% were undertaken by just one man. We then go on and we've got our home straight service. So this is a service quite recently commissioned by Tunbridge and Malling Borough Council to help support the residents in the borough who have got hoarding or needs associated with clutter. So this helps support those homes that really do need support to declutter, make them safer. Sort of demonstrated in a couple of those case studies. We come across this quite often. We've got Frances Tate is now employed. She's a 0.5 full-time equivalent, so she's part-time, but she's really made a difference since she's been in the role in the last year. It's tenure neutral, so again, we can work with people from various housing needs. And the referrals again can come in from anywhere, providing we've got customers can to be referred into us. So the last year there, you can see, as I say, it was a new service last year introduced. 21 referrals came in, 13 have been completed, and just a breakdown there of what the underlying behaviours are that bring people to have these sort of hoarding tendencies. Be there the breakdown of causing underlying. We have a case study here for you. So one of the cases we've had, the police were attending to the home after the sudden death of the wife at the property, leaving two younger children at the ages of 12 and 14. Police raised significant concerns regarding the condition of the home. Both parents were hoarders. We believe the influence by the mother's medical issues and the father's role as both a full-time worker and carer for his wife and the children. There were large piles of rubbish present in every room and mould visible on the walls. Children's bedrooms were of particular concern. They did not have any beds, sheets, duvet covers, and the mattress was blackened with the mould and dirt. Rubbish was piled high and the floors were not visible. Plates containing mouldy food were laying around where the children slept. So overall, the property was a significant risk, made worse by the fact that smoke alarms have been removed as well. So the risk of fire there. At the time of the referral, the father and the children had temporarily moved to stay with the maternal grandmother. And as quite often in these sorts of cases, family members have not been in these properties for years because people make excuses due to their embarrassment at the conditions that it's got into. The family did work with us, and again, we could get 2 quotations to help carry out the work to declutter and clean. The contractor was appointed to carry out the works. The customers agreed to purchase new items into the property, so sofa, double bed, single bed, so they all had somewhere to sleep safely. And following the declutter, the went on to get rid of further furniture and work on some of the other smaller areas. And the father-in-law stepped in to help decorate it and make it look better. I do believe on the following slides now, we've just got some pictures of what the property did look like for tech. It was really a difficult environment for them to live in. This is what was achieved once the clearance was done. I had a massive impact on the family and continued to live their lives after mum and the wife. To bring you back onto the handy person service. So again, this is a service that is subsidised by Tunbridge and Malling Borough Council through the funding that we receive. So that helps subsidise the service for eligible customers. This service is there for people to have all their small odd jobs, DIY type tasks done around their home that they're no longer able to do themselves. The standard cost of the handy person service is £25 an hour for all residents. If they do qualify, because they're on a means tested benefit, then it is reduced to £12 an hour. The residents, our customers are responsible for the cost of materials on top of that. So we're happy for them to provide it, or we can assist by getting some of those materials for them if they're unable to get out and provide them themselves. So we'll do all those small DIY type tasks just said. So, think about whether it's flat pack, putting up the shelves, blinds, minor plumbing, the dripping taps, problems with the toilet systems, you name it, the guys will go out and, work their way through the things that people have. And the customers get to know us very well. So we then do go back up regularly. We employ all of our handymen ourselves. They are employed by us and they are fully DBS checked in uniform. And there you go. Picture of the crew. They're a really friendly bunch. That's the end of our slides. And obviously, we'll take any questions if you've got them.
Councillor Palmer.
Thank you, Chair. In the very first case study you raised, there was a £14,000 shortfall, which, because the gentleman had been in the armed forces, you were assisted by I think. What if he hadn't been in the armed forces? Where does he stay in hospital because there's a shortfall?
It is quite a tricky question, and there are multiple outcomes or possible outcomes. When we're working with customers where a top-up is needed, we're always exploring whether they have an occupational pension. Quite often, if they've been in a career where there is something like that, maybe the police force, Royal Mail, etc., there's a charity normally behind it. In this case, it was a military charity. ACC do also offer loans, so they can top up as well. They brought that system in quite some time ago. Linda behind me will be aware there was, we've worked closely with Linda for a long time. So if they do get very stuck, they can do that. And as I mentioned before, sometimes some of the districts and boroughs have amended housing assistance policies and will either offer a top-up grant on top of it as well. So it really depends on the circumstances and how far we can go with it. But there isn't always a successful outcome for every customer. I would say 99 out of 100, we can bring it to a satisfactory conclusion. In some cases, it may be that some things have to be trimmed back just slightly, but we do our best to get where we need to be with every customer by hook or by crook. But it sometimes takes a bit more time as well, dovetailing it all together and finding where those pockets of funding and money come from. You're welcome.
Linda, do you want to add some more detail?
Yeah, just to confirm that Tonbridge and Welwyn do offer a discretionary funding up over the maximum. But we would expect all the avenues that Donna's just explained to be explored first, but we would step in.
Thank you. Any other questions? Councillor Pilgrims.
Thank you, Chair. Thank you very much. Very informative. Just two questions, please. I'm assuming that the service that you offered is across the whole board, so private residents and housing association residents, or?
Which service particularly? I mean, we don't discriminate against any, so it is tenure neutral. So we do a raft of adaptations across owner occupied, private rent, housing association, and anyone can access the other services too.
Okay, yeah, thank you. Looking ahead, say 10 years time, where do you see the demand 10 years time, and is it a service that is scalable over that period?
I think there are lots of challenges on the horizon, probably sooner than 10 years time. Devolution and the reorganisation of local government will come with its own challenges, and will probably, as an organisation delivering our services, I think the first challenge may come according to what lots of districts and boroughs end up joined together. So whilst we do deliver some adaptation work, for example, in Sevenoaks, they do a lot of their work, what they call in-house. So if Sevenoaks was one of the districts or boroughs that got joined with Tonbridge and Welwyn and another, you know, how that gets resolved or how long that takes, I don't think devolution is going to happen overnight. I think there'll be years unravelling the mysteries of bringing districts and boroughs together and trying to work together. So I do think there are challenges quicker than what you're saying ahead of us. And I do think we are going to have to sort of slightly suck it and see how that turns out. Welcome, thank you.
Councillor Hood.
Thank you very much, Chairman. Thank you very much for you, Donna and Annette, for your presentation. Really, really good. I've got some questions. So at 4.43, there's a reference to a sum of £678,000. So that's a lot of money, and I'm assuming that's the money for work that's been sorry, is there a problem?
We're just having some discussion about linking it to a particular report because there wasn't one included in the documentation. But
Councillor Hood, I think you might be referring to the Disabled Facilities Grant report that's later on the agenda, but
okay,
so it's separate to Linda will be
there's
presenting that later.
There's lots of similar.
There are. Yeah.
Oh, okay. So yeah. Well, I wasn't gonna. You relax. So obviously the work that you do is fantastic. I've got family members who've made use of the hoarding service, and I know it has made a huge difference. And it's and the work you do is incredible in allowing people to come back to their homes in a in a short space of time. And the handyman service, it's only been with the council for a little while, but it has real results. And I don't know if you can ask the question or whether it's for other officers later when we get there, about where we install stair lifts. Stair lifts are really quite expensive. And I know from some families they've tried to return the stair lifts, but the council's not receptive to having the stair lifts back. And I know there's problems with storage and all this kind of thing. It's probably a logistics thing. But is that the reason why? I'm not sure whether Linda's going to thank me for the question.
Linda, do you feel it's properly left the question until we get to your section on disabled facilities?
I mean, it'd be useful to have the HIA's perspective as well. From my perspective, it is about storage, and it's also about there's very few stair lifts that are not individual to a certain set of stairs. Therefore, reusing them actually is harder than you think, and can be more costly to adapt than actually just putting in a new stair lift.
Thank you. Councillor Dalton.
Thank you very much, Mr. Chair. 2 questions. On your first presentation about discharging from cottage hospitals, you mentioned a step-down bed. Can you explain what the step-down bed is, please?
Yes. Quite often these days, if someone has been an inpatient at an acute setting and they're not fully medically fit to be discharged, but probably need a bit of physio or some rehabilitation, there are around Kent various facilities that they term as a step-down bed, and they might go there for 1, 2, 3 weeks while some intensive physio takes place to help rebuild maybe muscle matter or give them the strength to enable them to then go home. But what they're not doing is actually then occupying a much needed bed in an acute setting where another patient needs it. So it's a bit of like a halfway house almost before getting them home. Bit similar to a cottage hospital, but it probably comes more designated with what actually happens there.
Right. Okay, thank you very much for explaining that to me. And the second part of the question, I've worked in the domestic dwelling field for over 54 years. When I saw the slides about that house, I was disappointed, to say the least, because I've never in 54 years have I been in a dwelling to that stage, only once. And I've been in from Lords to Little Lady in the caravan type scenario. So how do you, or do we, get that situation brought to our attention before it got to that stage?
That's a really good question, and I'm not entirely sure I'm going to have the right answer for you. I think, this is me personally, but I think over the years there's become quite a disconnect with friends, families and neighbours. And our case study there said that that family had had no one visit them for 10 years, purely because they probably didn't let them visit. So I could regale you with all sorts of stories, from the little old lady that wears a twin set and pearls and pops along to her GP and knows all her people in the village, but no one ever goes in her house because actually she can barely get the door open to get in. But she'll pop down and she'll use the local conveniences and maybe wash and tidy herself up. And to the outside world, she looks amazing. But she lives in shame, as she would see it, because no one will go there. And this is the problem when you don't know your neighbours, or you fall out with your family and you stop visiting. And of course, a lot of these people as well are people that always lived at home with mum and dad. Mum and dad have passed on, they inherited the home and they can't pass with parents' belongings. There's all sorts of quirks and reasons, but as a society, people get a bit forgotten, and it's very sad, but that is the case. But we're lucky, we've got people that work in the community, you've got PCSOs, community wardens, and quite often, as in that case, we might never have found out about that family, but very sadly, the wife passed away and he had no choice but to call the emergency services. Had that not have happened, we might not have known for a long, long time. And I can't give you an exact answer, I just don't know. But actually, what we showed you there, whilst was extreme, I've seen worse, literally.
That's what I'm trying to drill down to. Why or where are we failing a family in that situation? What can we do? I'm looking at Linda, who does a fantastic job, but I was embarrassed by looking at that, and it somewhat upset me.
If people don't want help though as well, it's very difficult. If they refuse help, you know, which people can, if they've got the capacity, they won't let you in.
Sorry, I don't think everyone understands that that's not how everyone lives. That's their normal. And there's a lot more people with neurodivergence these days as well. There's so many different reasons behind it, but that for most people, that's their normal. And it takes us months with some people to even get one carrier bag of rubbish out of a house because they simply will not let go. And they wish to sort bit by bit by bit. But we're working with a customer in Tunbridge Wells, and the only space in his house was between the ceiling and the void of rubbish. He was crawling between the ceiling and the void. So you think that's bad. You want to see the pictures for that case study. We're still working with him now, but he's been really receptive to finally having the help. He'd had a fall. He was trapped in the house and someone found him, and that's how that case come to us.
Another one in Tunbridge and Malling, very similar, that's started, but again, they live in a mobile home and it's that far from the sea. And so, and again, that's just a case we're on, so that'll be a case study for another meeting.
Councillor Palmer.
Thank you. On that particular point, I'm surprised that the schools didn't pick up with the kids and highlight quicker from that point of view. From my my information for you about stair lifts, having just purchased, well, a year ago, a stair lift from a very, very well-known stair lift company at £6,500. The engineer said to me, "Oh, when you don't need it anymore, we will come and take it away for you." And I said, "Oh, you buy them back, do you?" "Oh, no, we'll take it away for you for free, because the only bit we use is we refurbish the chair, and the actual piping bit that goes up the stairs is of no use whatsoever." So they just refurbish the chair if it needs it, but apparently a lot of them don't even need that. So yes, they're expensive items, believe me.
Right, I don't see any other questions. I'd just like to say thank you for a really detailed and entertaining and informative, really. Well, I'll forgive you. But no, that was a challenge. But I just would like to say that we do adapt sensitively the English language, because I picked up something that was clutter image rating scale, which is a nice way of putting mess, isn't it? But and I understand that you need to be sensitive, and that picture was only an 8, so like you, I was thinking, well, I wouldn't want to see a 10, but quite thought-provoking. But thank you for coming. We'll take a brief respite and let you be on your way. Thank you. Right, ladies and gentlemen, thank you for your indulgence. I've had a suggestion, which seems a very good one to me, that we bring forward agenda item 9, which is the Disabled Facilities Grant funding reform. And Linda's going to present that. So we have a sort of mindset which can flow from the previous item. So Linda, please.
Thank you, Chair. So this report provides an overview of the proposed changes to the Disabled Facilities Grant funding and what they mean for Tunbridge and Marlin. As you've just heard from Donna and Annette, the DFG is a ring-fence government grant that funds essential home adaptations, helping disabled and older residents live safely and independent in their own homes. It also supports a range of key local services that we've heard about, including hoarding support, hospital discharge work, and the handy person service, all of which help reduce pressure on the health and social care services. The government has recently reviewed how much disabled facilities grant funding is allocated nationally, with a new formula aimed at making distribution fairer and more reflective of need. While the new model suggests a lower fair share for this council, transitional protections will limit any immediate reduction in funding over the next 3 years. So over that period, the council is expected to see an overall reduction of around £125,000, which can be managed through forward planning. Importantly, the council currently has an underspend that we can use to kind of counterbalance some of that, which provides with financial resilience in the short to medium term. As a result, there is no immediate reductions to existing services anticipated. We will keep the position under review, and obviously any future decisions will be informed by demand, spend, any further funding announcement. Thank you, Chair.
Thank you, Linda. Have we got any questions for Linda? Councillor Hood.
Now I'm finally on the right item. Going back to what my question from earlier. So we've got this figure of £678,000, which is a lot of money for work that I'm assuming is being kind of awarded towards, but it's not been completed. The works haven't been implemented. So can I have an idea? How long would it normally take to from start to finish? So what would be the maximum kind of waiting time that somebody applying for this would expect to wait?
It would very much depend on the adaptation. I think, a complex adaptation that was described earlier, where you were looking at costs of, over £40,000 and quite significant works, you could be looking at, maybe 12, 18 months. Other more simpler adaptations, so putting a stair lift in, a level access shower, if there's no other complication, we would hope to get completed within 6 to 9 months. Obviously, there's a process outside of Tunbridge and Marlin, which is the occupational therapy assessment, which is done at Kent County Council. At the moment, there's no significant delays there as far as we're aware. So, but it very much depends on the complexity of the adaptation being talked about. And then, as Donna explained, if there's additional funding being sought, that can delay it as well. The 678,000 mentioned in the report is, as you say, it's where works have been approved, so the funding has been committed to, but the work hasn't actually been carried out, so it's being carried forward.
Thank you very much. That's really reassuring. That doesn't sound like a long turnaround at all, really. And we've got reassurance that because that's a large amount of money to have underspent. Is that sum would be ring fenced only for this? We wouldn't be able to use that we wouldn't be able to transfer that to any other projects.
Yeah, it is a significant underspend. That underspend really started to grow during the years of COVID, and the programme's never really fully recovered, I would say, to the levels we were spending prior to that. But you'll see from the annex, spend is picking up year on year. But yeah, it's absolutely ring-fenced disabled facilities grant funding, so we wouldn't be able to spend it on anything outside of these areas of work.
Super. So that will see us out.
Thank you. I don't see any other questions, so can I ask you to note the report? Thank you. Thank you. Okay, well, we'll come back to agenda item 7, which is scoping report for the use of Article 4 direction to withdraw permitted development rights for small houses of multiple occupation, brackets HMOs. Members will be aware that we did have discussion and substantive motion at council last week. So we're obviously fairly clear of the direction of travel on this issue. That the report that Eleanor is going to present to us now is about the method of moving in that direction and the options and issues that might relate to it. So over to you, Eleanor.
Thank you, Chair. Just a few points that I wanted to pick out. At 4.2, the report mentions that that guidance around Article 4s talks about the fact that they need to be applied in a measured and targeted way. And at 4.3, that just explains when mandatory HMO licensing is already required. So that's when there are 5 or more tenants from 2 or more households sharing facilities. Although at 4.4, it mentions that although currently numbers in the borough for HMOs are quite low, there are examples of boroughs in London and in areas surrounding London in particular, where they've seen an increase happen in quite a short period of time. And so this issue was first raised with me by Cabinet members in late March to look at options. And since then, we've been undertaking the work to actually pull together some of the background information, which I'll talk a bit more about. But it's quite wide ranging and quite complex, which is what Section 5 covers in detail. There are a number of links at the end of the report to the background papers, which largely are where other boroughs have made a case for an Article 4 direction relating to this issue, and sort of the evidence base that they used and the issues that they considered in putting their report together. I've tried to look at a number of different types of borough with different types of situation to give a range of information, but certainly the numbers are higher in other authorities than in Tunbridge and Morning in terms of the number of existing HMOs. The 5.6 gives the basic information on the position in Tunbridge and Morning at present against some of those different data metrics, which will now need a detailed review to build a case around of that for an Article 4. And just also to bring to members' attention that our SHMAR, our Strategic Housing Market Assessment, which was produced as part of our evidence base for the local plan, does cover this issue and mention that there's limited evidence to support the moving forward of an Article 4. So I just want to draw to members' attention that we do have published evidence at the moment that has a different conclusion. I think it's just important to have that context. Moving through the report, at 6.1, I just wanted to point out that this paper was obviously written before the council meeting last week. So an option around sort of a wait and see approach was something I had put forward as another option, but obviously given members' position last week probably isn't relevant any longer. At 7.2, the report mentions the financial implication, but there's no budget currently identified because this is the new area of work for the consultancy work that's going to be required to formalise the case for an Article 4 direction. Our initial estimate is £25,000, and so we will need to bring a supplementary estimate to the next council meeting in order for that to be put into the budget process, but that can run alongside looking at the work. Section 8, just to pull out a couple of issues from the risk assessment. One is that the Secretary of State retains the power to modify or cancel a direction, and this power is used fairly routinely. If you look on the gov.uk website, there are lists of the Article 4 directions that have been modified, so they will ensure that they think it is meeting the Article 4 direction requirements. Also, just to highlight that at the moment, in terms of the position with HMOs. For those smaller HMOs, the council has no decision-making role in whether they can be used as HMOs. Obviously, if this Article 4 direction is brought in, then under a different set of legislation through planning, we would then be making determinations on those. So I just wanted to raise that in terms of the risk around expectation management with stakeholders around what is then available to the council to consider. I've mentioned the fact that we're going to look at external support to deliver this at section 11, the proposed timetable for implementation, which is at pace to meet member requirements, is laid out. Also, just to be clear, we don't have the capacity in-house to deliver the work. Certainly in that period of time, it is quite an intensive piece of work to get the evidence-based document produced. And so that's the proposal that's in front of members to recommend to that a cabinet member decision is made by Councillor Taylor to commission the work alongside, as I say, the supplementary estimate being sought so that we can get this moving and hopefully delivered over the summer. Thank you, Chair.
Thank you. Any questions? Councillor Thornywell.
Thank you. I've got two questions. First of all, could you explain what paragraph 2.1 means? Where it talks of outdoor areas of importance. And question two, what is the position concerning this in the other authorities we're likely to join, Sevenoaks, Tunbridge Wells and Maidstone, please? Have they got Article 4 orders?
On the section 2, that's our corporate strategy priority area. So improving housing options for local people. That sentence is the strategy priority area, and that's what we're required to put into the report. So the overall position, the overall sentence from the corporate strategy just happens to also include outdoor areas of importance. But obviously this report relates to the first half of the sentence. It's just that's the area. So I'm required to put into the report which priority the work is meeting. In terms of neighbouring boroughs, my understanding is that Tunbridge Wells and Sevenoaks don't currently have Article 4s for this purpose. Maidstone have explored them and have looked at specific Article 4s, not around HMOs in general, but around restricting housing use for office buildings, particularly in the town centre, and have been looking, and it has been publicised that they've been looking at some specifically for some large buildings owned by the county council to ensure that those can't be used as HMOs potentially in the future without a planning process. So at the moment, there isn't a lot of this happening in the West Kent area.
Councillor Bridge.
Thank you, Chair. Eleanor talked about a direction of travel. I'm just going to query whether that's the right direction of travel. Requiring planning permission to convert houses to HMOs certainly has some positive attractions, allowing the council to manage delivery of mixed and balanced communities and considering proposals on their merits. But as the report says, the National Planning Policy advises that Article 4 directions should be applied in a measured and targeted way, supported by robust evidence and limited to the smallest geographical area necessary to address clearly identified harm. Well, looking through the report and some of the data collected already, I can't see that there's any clearly identified harm. We have a low number of HMOs currently. There's little evidence so far that these are a nuisance in terms of antisocial behaviour or noise, and there are no complaints in the 5-year period mentioned relating to poor housing standards in these HMOs. And as Eleanor has pointed out, the council's SHMA states that evidence doesn't support introduction of Article 4 directions to manage HMOs. The borough has different demographics and socio-economic factors to compared to some of the boroughs that have been referred to here. I mean, we're 72% owner occupied, whereas places like Medway, the wards where they have a particular issue are very much more private rented and social renting sort of scenario. So I don't think we're necessarily comparable to some of these other boroughs. Rather than spending around £25,000 producing this report at the moment, shouldn't we rather be sort of monitoring the position over a period of time to see if there are any significant changes to any of those data elements? Thank you.
Yeah, I don't think it's something that Eleanor can in perspective, but the reason why I mentioned direction of travel, because that was the motion that we discussed, council being the highest chamber in the council, and it indicated a wish to move in that direction. And what we're looking at now is the evidence package, and if there is a judgment to be made about when and how and if even, then that will be made based on the report that Eleanor is putting forward. But if it is contrary to the motion that has been discussed in council, then presumably that will be another discussion we'll have. But in terms of where there is a perceived problem now, there was a sufficient concern of a problem which is developing, which we wish to be preparing for. So I don't think that we can answer your question, but we note your concern. Thank you. Councillor Hood, then Councillor Taylor.
Thank you very much, Chairman. The motion that was brought forward to council obviously asked for the evidence to be assembled, and lo and behold, the evidence has been assembled in great detail, and I commend the author for the report. It's very comprehensive, and it sets out the local situation admirably. So at 5.2, the report sets out all of the potential benefits which would enable us to have some control where we currently have none. We know that things can change very quickly, and if you've got a proliferation of HMOs, it can make residents' lives a misery, particularly when you have situations where suddenly you've got areas that are overwhelmed with cars and there's nowhere to park them. I think that the report really is excellent in that it sets out how things are so different in neighbouring boroughs, but it also sets out that the criteria seems to be incredibly high for this to be able to get past the Secretary of State. So I'm in two minds about this. I mean, I certainly support looking into this and assembling the evidence so that the whole council can see exactly where we stand. But I can see both sides. I can see Councillor Bridges' point here as well. So thank you for the report, and I'm gonna be interested to hear other members' opinions on that.
Thank you, Eleanor.
Thank you. Thank you, Councillor Hood, for your kind comments about the report. What I would say is this is an assembly of information, and what it isn't is making a case. I am certainly not an expert in this work area. This is me going and reading all of those reports and pulling together data, which I'm very capable of doing. But that next stage of work, if that is the direction of travel, and as it is that members have set through council, that's where my advice is that we require some more specialist advice to take that data, add to it, and potentially picking up on Councillor Bridges' point about authorities that maybe have more similarities to us if those case studies exist, and then preparing a case for an Article 4 with whatever geographic and other restrictions that might have. That's the piece of work that I think would need to happen next for members to have a really clear understanding of what an Article 4 might look like.
Thank you, Councillor Taylor.
Thank you, Chairman. I'm not a member of your committee. I just wanted to pick up on the point that you made and Councillor Hood made. if the evidence stacks up, it's better to have an Article 4 direction in place and not need it than need one and not have it in place.
Councillor Thornywell.
I think this is a total waste of money. And I do have regard to the paragraphs concerning risk assessment. And I draw to the council's attention that at the council meeting, there was no risk assessment. So I shall be thinking about that, because I thought we're supposed to have a risk assessment before we make decisions, and we clearly did not have a risk assessment at the council. And I'm not clear. I understand what the council passed, but this report doesn't appear to have a recommendation. So what are we being asked to do, please?
In terms of the recommendations, Councillor Thornywell, the recommendations are at section 3 of the report, and members of this committee are being asked to note the content of the report and the evidence presented in relation to the potential use, because it's a scoping report, and also to consider whether further work should be formally undertaken to review the potential use, with funding being put in place. So that's to note the point about needing a supplementary estimate on the basis that the programme laid out in the report would allow Cabinet to make a decision about an Article 4 at their meeting on the 1st of September. So those are the two recommendations at 3.1 and 3.2.
On a point of order, Mr. Chairman, it seems to me that 3.2 has been overtaken by events at full council. Is that not right?
I'll answer, and then all can correct me. No, the need is there for further work. We've identified that, and to actually look at the ingredients for making the case for an Article 4, which we would need to do anyway in making the case to the Secretary of State. Got anything you want to add, Eleanor?
I want to vote against these recommendations and have my name recorded as voting against in the minute. And that also gives me the ability to follow up the question of the council not doing a risk assessment.
Councillor Betts.
Thank you, Chairman. Not a member of your committee, of course. I'm a little bit confused because the motion that was brought forward by the Green Party after an Article 4 with immediate effect. But obviously that motion was amended to basically say the use of a targeted approach rather than a blanket approach to the whole borough. So in the motion that the Green Party put forward, it was to apply Article 4 across the whole of the borough. And then obviously it was amended that it should be a targeted approach based on obviously what we've heard from Eleanor in terms of how the Secretary of State can obviously intervene if you're blanketly applying an Article 4. I think that's where we have to be mindful here, is that it's a targeted approach that this report is more so looking at, and obviously looking into the detail of how and when and the cost of applying that. So it's not actually going ahead and actually doing it. It's actually providing more information on a targeted approach. The question I have to Eleanor is, you did mention about the Secretary of State has intervened on numerous occasions, and I'm just wondering, is that particularly in relation to where local authorities do apply an Article 4 in a kind of blanket approach? Thank you.
I would need to come back to you with details, Councillor Betts, because each one has a specific item on the gov.uk website with the specific issues of the case. But perhaps, and I certainly think we could do this within the scope of taking some advice, it might be useful for whoever does the piece of work for us to maybe highlight where some of those modifications have been made, and therefore where that might provide a steer on how we, if the council votes for an Article 4 of Cabinet, move that forward, how that might best be done in order to, reduce the risk of potential modifications. So we could pick that up that way, but I can also send members the link if you wish to go down the rabbit hole of clicking on all of the links on the gov.uk website. And if I could, Chair, just pick up on the point about the scope and timing. I'd have to refer the question about risk assessments on motions that can be brought at any time to my colleague Adrian Stanfield. But when a motion is made and then there's work to do, I suppose this is the work. It just happens that this was actually already happening, you know, behind the scenes, as it were. Officers had already been asked to start preparing this, and the motion happened. So had the motion not happened, this would have come forward in any case. But had the work not already started, the motion would have kick-started that process, and we'd probably have been here at the next Housing and Planning Scrutiny Select Committee. But yes, so I think we'd have got to this point.
It's on my agenda for tomorrow.
Councillor Hood, did you have a question?
I didn't have a question. I have a point of clarification. Thank you very much, Chair. The motion that was brought to full council clearly says that the Green Group calls on the Cabinet to instruct the planning policy team to prepare the necessary evidence for consideration of the replacement of the current Article 4 directions. So at no point did we suggest that Article 4 directions be imposed, because that's illegal. That would be an impossibility. So we asked for the evidence to be for the ball to start rolling, and the ball had already started rolling, and we're very pleased to see that is the case.
Okay, that's a fair point, and I think rather than keep going around the merry-go-round and going over what happened last week, I think we're generally in agreement that the report is a good step, and the consideration of the work to be undertaken to acquire more evidence is a good step. Now, it may be, are you still of the mind, Councillor Thornywell, that you want a recorded vote?
I just want my vote recorded. It's up to other members. I want it recorded because I always take the view that if I'm raising semi-legal matters regarding anything that the council proposes to do, I want to be sure that I voted against whatever it is.
Okay, thank you. So moving forward, I'm going to propose the two recommendations. Could I have a seconder, please? I've got Councillor Davis. So I think we'll move forward on a show of hands. So if we could have a show for the recommendation, please. Councillor Thornywell has indicated that he wants his name recorded against that vote. Okay. Okay, we're going to proceed. I'm going to acknowledge your request, and we're going to check whether constitutionally we can go down that road, and if we can, we will. Fine. Okay, coming on to agenda item 8, which is the updating of the council's affordable housing policy, and Eleanor is in the chair again. Thank you.
Thank you, Chair. As members of this committee will be aware from previous reports where we've discussed the challenges with securing affordable housing, and also from the presentation given by Brian Horton, who's the co-chair of the Kent Housing Group, to a recent meeting, this is a really challenging area of work, and officers have been working to secure affordable housing in line with policy in the face of a really rapidly changing landscape. The protocol was first put in place a few years ago, and the policy landscape, as well as sort of the practicalities of delivery, have significantly changed. One key policy example is that there was a First Homes policy was a flagship policy of the previous government, and therefore the existing version of the protocol reflects that heavily. First Homes, whilst it still exists as a potential tenure, is no longer mandated in the same way in planning policy, and so that was one of the key reasons for the change. We've also been looking at our processes and how we engage both with developers and registered providers, and we want to make this protocol a really effective operational tool to set expectations so that members know exactly what to expect and exactly how we're engaging with developers and registered providers, and also to have consistency of approach. Whilst we have been using tools like viability assessment, we haven't been using them in every single case, and so we want to make that position very clear to applicants, and whether those are new applicants with new schemes or where, as again we've discussed with this committee before, where applicants are coming back to look at amendments to the affordable housing provision within their scheme, and how we will deal with that so that it's a really consistent approach. We are also spending more time on this as an officer team. Myself, James, Linda and key officers from planning and housing are meeting on a regular basis to compare conversations to ensure we're having that consistent approach, and we really think that updating this protocol will provide us with that really firm basis on which to ensure we're doing as much as we can to secure as much appropriate affordable housing as possible. Thank you, Chair.
Thank you. Any questions for Eleanor? Councillor Hood.
Thank you very much, Chair. Obviously, the fundamental problem is that the housing market is broken, and the private sector is failing us, and the planning system has over the last few years failed to deliver the number of affordable housing, especially social housing, that we require, and we've seen that in a number of planning applications in Tunbridge, where the number of units has reduced to zero on a couple of developments, and that has been massively frustrating. So anything that can improve things is absolutely welcome in my book. This is going to change the protocol, isn't it? But it's not going to. It doesn't change the policy. So 7.1, I just wanted to have a clarification there, where it says it believes the existing policy requirements at 7.1 that changes the protocol, but not the policy as it stands. So that's good. At 4.4, it says, for the avoidance of doubt, social rented housing includes social rent and affordable rent for the lifetime of this protocol. So it's not possible, it is not within our powers to change that, to insist on greater numbers of social housing within that mix, because of our previous plan. That's my question. It's not, we can't firm up that paragraph.
Yes, so policy doesn't change. That remains as is. We obviously have emerging evidence that's come through the local plan process, which is informing those new policies, and which does suggest a greater requirement for social rented properties. We can't require it at the moment, but we do. Please let me reassure members. I can guarantee you that there is our housing lead officer, I would say, in every conversation that she has with a registered provider, will not leave the room without having had a conversation about social rent with them. And we do have registered providers in the borough who are really keen to provide properties at social rent, but finding the right mix and being flexible around that is absolutely key. And we think this policy allows us to do that.
Councillor Thornyball.
I think this is a reasonable way forward, and I propose we accept the recommendations.
Could I possibly, I'm so sorry, James has just pointed out that I have made an error in the document because it actually refers to the 2021 MPPF. I thought I got all the 2021 references. My sincere apologies to members, but it's at the point of 3.1 about our evidence base. It says it's been assessed against the 2021 PPF. It hasn't. It's been assessed against the current MPPF. So with members' indulgence, I will update that before the protocol is published.
Thank you. Councillor Thornhill, I'll note your recommendation, your proposal, but I'll come to Councillor Hoskins first. Thank you.
Yeah, apologies for being extremely pedantic, and I wouldn't normally, but I've spotted two word errors which actually mean the opposite of what the word should be. In 4.1, we talk about working constrictively, and I think we mean constructively. Yes? 4.1, working constrictively with applicants to secure delivery. Yeah.
In the covering Oh, yes. So that's in the covering report. You're absolutely right, Councillor Hoskins, but that won't be published because
no. Okay, there's another one at 4.4 where we talk about negations with developers as opposed to negotiations. So yeah, as long as those are corrected, because they do mean the opposite of what you mean.
They do mean the opposite. Again, my sincere apologies to members. What an excellent example I'm setting for my colleagues this evening around proofreading my own reports. As I said, just
teachers.
No, you're entirely right, because I would do the same if it wasn't my report. I would have red penned it for somebody else. Absolutely. And just to be clear, we can update those, but because those are in the covering report, they won't be part of the published information. That will just be the annex that's the protocol. But thank you, because you're absolutely right to point it out.
Thank you, Councillor Hoskins. I bet she can spell dyslexia, though. Have we got any other questions? Okay, well, I have a proposal from Councillor Thornhill to accept the recommendations, and I will second it. So are we happy to do that by general affirmation? Thank you. Coming to agenda item 10, which is the Regulation 18 Local Plan Summary of Responses from Statutory Consultees. It's a double act between James Bailey and Kelly Sharp. How are we going to play this, James? Kelly is going to lead off, so off you go, Kelly. Thank you.
No problem. Thank you very much, Chair. Okay, the purpose of this report is to provide members with a summary of the responses received from statutory consultees during the Regulation 18 local plan consultation, which closed earlier this year in January, and to also give an early indication of how the main issues raised are being considered. By way of background, at the last Housing and Planning Committee in March, members were advised of the overall level of response to the consultation, including which statutory consultees had responded, and also that report provided a high-level summary of the key issues raised. The report also outlined in broad terms how officers intended to take those responses forward as part of the overall analysis of all responses. Annex 1 to this report provides a more detailed summary of comments received from the statutory consultees, including the Environment Agency, National Highways, Historic England, the NHS, the Marine Management Organisation, National Grid, Natural England, Network Rail, South East Water, Southern Water, and also Kent County Council. And direct links to the full responses are provided should members wish to review those in detail. In terms of the role of Regulation 18 and ongoing engagement, Regulation 18 represents an early stage in the plan making process, and it's intended to help shape the local plan. Following consultation, the responses are considered in detail, we prepare further evidence, and then the plan is refined, moving towards Regulation 19. Although the Regulation 18 consultation did include quite detailed draft policies and site allocations, engagement with our statutory consultees and other key stakeholders continue throughout the plan making process. And this ongoing dialogue is used to test the emerging policies, the site options, and to work through planning issues as this evidence evolves. And just to say that this engagement will also continue through to Regulation 19 and potentially beyond, moving towards examination. It remains the role of the Council to consider all the representations made and to also make balanced planning judgments in taking the spatial strategy and the policies forward. And we of course have to have regard to national policy, planning guidance and also supporting evidence to ensure our plan is sound and robust. In terms of next steps, officers are currently preparing the Regulation 19 draft local plan. Members will be aware as of today that further briefing sessions have been arranged to explain how the spatial strategy in the local plan is evolving and how it's evolved since Regulation 18, and also what we are now testing to inform the Regulation 19 stage of the local plan. Further evidence is also being progressed to help inform this process also. Also meetings, I don't think they've come through just yet, but further opportunities for member engagement in a similar way as before will also be arranged to discuss the emerging draft policies. I don't think I need to say anything more, Chair, because I think the detail is in the annex. So thank you.
Thank you, Kelly. I have Councillor Hickmott.
It's very interesting. I've got a comment about the Environment Agency. We've got a waterway in Snodland called the Brook, which is nearly choked up. In some parts, it's only about 3 foot wide. I've been on site with what was the Lower Medway Drainage Board. They are gonna clear there. There's a stream adjacent to the brook. I think if we get a deluge, I don't think it's going to be able to clear the amount of water that's going to come down there. Right next to the brook is the sewerage works. Now I can see sooner or later, because they are refusing to undertake any maintenance, and they're talking about flood zones, which is quite, relevant. It could possibly go over the bank, because the bank on that side, the western side, is lower than the eastern side. It could be at risk, which so if we get a substantial downpour, it's going to have trouble clearing. So when they're talking about financial contributions, I'd like them to think about actually clearing some of the waterways that they're responsible for. Thank you.
Thank you, Kelly. I'm not sure if you want to come back on that or not. I don't think you really can you? Shake of the head. Thank you. Councillor Thornewell.
Right, just to comment on that, I think we call it the Leybourne Stream, as it runs through the country park, and the Environment Agency do clear that section, and of course some of it, half of it, if our boundaries in the middle, might belong to us as owners of the country park. Anyway, coming to this report, one or two comments if I can. The comments of the Environment Agency and groundwater and contaminated land. I'm pleased to see the officers are proposing to draft a policy to cover that, because I think it's important. Having copied this off, I've copied it up, so what the next page is upside down. But national highways, I think that's an important comment they've made about how you assess highway issues. And quite rightly, it says the local plan is to be drafted to ensure the vision. This is active travel, isn't it? And obviously that's the government's stance, and we've got to include it in the local plan, although people like me don't believe in it. But it's really relevant as to how we are going to deal with highway issues, which are the big things that people raise on planning applications. Number one, the roads are not able to cope. And then could I refer to the Marine Management Organisation? And they say they would welcome a reference to the South East Marine Plan within Chapter 2 of the local plan. And as I read what we're saying, we're not very committed to that. And I would say that we should include a reference to it. And it says the effects are small, as the section of Tunbridge and Malling implies, is of the tidal Medway is only a small part. But I think that the tidal section of the Medway is a significant part of this borough because it runs just short of Allington Lock, affecting the parishes of Aylesford, my own parish of Larkfield, Burham and Walden. Sometimes there's a thought that it's small because when you stand in Walden, the other side of the bank hauling is in Medway. But nevertheless, the whole of the estuary, I think, is important, and it should be recognised as important, even though it's split between ourselves and Medway. And I just make that as a comment, but I would like to see us make reference to this marine plan. But then I can't resist not ending by making reference to South East Water and what they have to say. And really one of the things that's probably no one here can answer it, but a lot's made of this argument that South East Water or water authorities generally have to supply water to dwelling houses. But what I've never heard anyone say is, who's supposed to enforce this? And what is the mechanism for enforcing it? And what quantity of water? I regret I couldn't get here. I would have asked the barrister you had. But it seems there's a conflict here. Somewhere in here it says we have to take cognizance of what people say to us. So we have to take cognizance of what South East Water say. And in my view, if that's a legal requirement, we have to make some decision based on it. But it's contrary to what the government wishes. And I do see that as a conflict. Probably can only be resolved by, I don't know, the Supreme Court or something.
Councillor Thornhill, I mean, a lot of that is for noting, but I'll hand over to James for the last point. Thank you.
Obviously, Water Industries Act is the formal piece of legislation which deals with an automatic right connection to the water supply. So that's dealt with outside of planning, but that's the piece of legislation. It's various sections of that, sections 41 to 53, I think, deal with effectively the rights to connect for households and developers, the right to connect to a potable water supply. So as I said, that's covered under the legislation, and that is a formal right to connect, but they do it under sort of a requisition notice to the relevant statutory undertaker, South East Water, Southern Water, etc., whoever is the statutory company. In terms of current requirements, obviously, current requirements are set out in the Building Acts in terms of litres usage per person per day. That's currently set out in the Building Acts, and that's currently limited to 125 litres per person per day. Obviously, in areas of extreme resource issues, that can go down to 110 litres. So that's the formal legislation that controls water usage, and that's set out through approved AIs, building inspectors, and through local authority inspectors. So they control that through the building legislation on that element. And obviously, moving forward, the local plan in the current draft of the Reg 18, we looked and we're proposing 110 litres, so a reduction from building regulation standards. And obviously moving forward as a result of the South East water issues, we will be looking at commissioning evidence base to look at that further to see whether that further needs to be reduced. But obviously that's further evidence to come forward in due course as part of the consultation. Hopefully that deals with.
Thank you for that comprehensive reply.
And obviously that the key governing body are Ofwat that sort of manage water resources management plans, because that is the formal sort of management plans that have to be put in place statutorily that deal with water over. Effectively, they plan between 50 to 75 years over the plan period, but you update them every 5 years.
Councillor Hood.
Thank you very much, Chairman. The Environment Agency have got quite a lot to say. So they're talking about they're going to require additional funding for flood defences or drainage works in the Waldham area. The council has recently released funds that were allocated for the Waldham area in terms of flood defences to reallocate to other capital expenditure. What I would really ask for is assurances that we are going to be able to safeguard, as they point out, the integrity of the aquifers that we rely on for our drinking water. They make a big thing of that. And it's good to see that the Environment Agency are also alive to the need to ensure that wastewater infrastructure has to accompany development as it emerges, and they expect to have a closer timetabling of improvements before the developments can be started. But I just want to know why didn't we go to the South East Water and the Environment Agency earlier about this kind of thing? Network Rail have made some interesting comments that I agree with in terms of connectivity of their network with active travel. Indeed, they make a lot of references to Tunbridge Station and the connectivity from the north, and we've got a huge strategic site in the north which our active travel plan doesn't have any reference in there for connectivity, and they actually suggest that we should have Grampian conditions applied to these developments, which we can apply until sufficient active travel infrastructure, according to what I read in this paper. The NHS tell us that that we need additional healthcare facilities in North Tunbridge, but we've got a situation where we're supporting a relocation of a surgery in the opposite direction into South Tunbridge. So I find that troubling. And then you've got this business which has been alluded to already about South East Water. So I'm really perplexed by the rationale before us, because we're told that when we get to 2035, we're going to expect all of our development to have a maximum of 80 litres water consumption, and that is going to taper to that. I don't understand how this is horizon scanning. Surely, if we are cognizant that we've got a water scarcity problem, we've got a water crisis emerging, why on earth wouldn't we be going aiming for that 80 litre now, and then we're ahead of the. When we had the conversations with members and officers, we made it clear for the Green Group that we wanted to see a significant reduction from that 110 litre target, which hasn't been forthcoming, and it looks like we're going to be heading there. But I don't understand why we're going there in increments by year. I'd like an explanation about that. And it also says that we're going to see water supplies are going to be improved. I don't understand where these aquifers are going to be appearing from. And then finally, you'll be pleased to hear, finally, Kent County Council are saying that they don't want contributions in terms of Section 106 contributions anymore, but they want the transport infrastructure to be planned and delivered through S278 agreements. So they're going to be constructed by the developers themselves. Now, I welcome that, because we've got Bardencroft in Tunbridge, which has been developed, and it's now in breach of its planning conditions because the cycle route that was supposed to accompany that development is undeliverable. So I'm really pleased to see that there's a change at KCC. But if we're not going to be, and we're not going to be increasing road capacity, then we really need to go back and look at that active travel plan again.
I mean, a lot of those matters, thank you, Chair, a lot of those matters are being looked at and will be updated in the updated evidence base going to the Reg 19. We have already committed the members that as and when that becomes available, we will seek to release that evidence base at the earliest opportunity to members have insight into that evidence base. So we've already committed to that previously. Just to go back to some of your questions in terms, I'm going to start in reverse on the transport elements. KCC's stance is not a new stance. In effect, sometimes you used to divide the infrastructure per site, collect a contribution, and then secure it through the 106. And then you'd have to look at design costs, delivery costs went up, construction costs went up, nothing ended up getting delivered. So KCC have sort of adopted a stance that actually the developers should deliver the infrastructure either by 278, by Section 38 of the Highways Act, and therefore on the basis they're trying to secure delivery of the infrastructure which aligns with the NPPF requirements, infrastructure first. So I don't think that's a kind of a new approach. It's been effectively adopted on the basis of not delivering previous infrastructure requirements. So hopefully that gives you some confidence. And if there are some big pieces of kit, as I call them, in infrastructure, in terms of mostly that be delivered by strategic sites, we would put those either through the IDP and the infrastructure delivery plan, which will set out infrastructure requirements, but also we've got site-specific policies for some strategic sites that will look at some of those delivery requirements. So there's kind of two areas that we would look to make sure those are required. And on the site specific, as I said, they're more likely to be aligned to the strategic sites. They will have requirements for infrastructure delivery if there are any big pieces of kit required as part of that. With regard to in terms of the aquifers, obviously, as I said, South East Water, I won't go into too much detail on that because the evidence base is still being progressed. We're not only procuring evidence, we're also waiting for updated information to come from South East Water, from discussions that we've had with DEFRA, with Ofwat in terms of looking at how that's going to come forward. And there will be a sort of an agreed position moving forward that members will see as and when that evidence base is progressed and completed. So you will see that in due course. We're currently going through that evidence gathering at the current time. And with regard to water usage, the previous policy in terms of Regulation 18 looked at 110 litres per day per person. As I previously said, building regs is 125 litres per day per person. South East Water have recommended a 90 litres per day per person in their Reg 18 comments. But in order to go to that level, and a planning inspector will expect to see an evidence base that justifies you effectively bucking national policy, and national policy set by building regulations. So we would need to have the evidence base to go lower than the 125 or 110 litres in drought areas. And obviously what we're looking at and we'll be procuring is the evidence base to deliver that. But obviously you have to have an evidence to set the level because that has to go into local plan viability testing. There's a whole load of criteria in local plans that we have to go through, which again have to be evidence-based led. Hopefully that in a nutshell probably doesn't deal with all your questions, but I think it deals with the key pertinent questions or the matters that you raised.
Right, thank you. I'm going to make a couple of points now. I'd given my time in leading up to this to Southern Water and Kent County Council. I'm coming to Southern Water first. I've supplied Kelly with a copy of my comments because this ones on Southern Water run to about 5 pages, and I'm not going to get you to bore you to sleep with that this evening. I'm just going to run through the conclusions. But I'm happy to share a copy of it with anyone that wants or feels the need to ask me for them. But the conclusions, as far as Southern Water is concerned, that as far as I see the report, that Tunbridge Wastewater Treatment Works is under significant pressure, and to relieve that pressure, raw or semi-treated sewage is being discharged directly into the River Medway. The River Medway is not a safe place to swim. I hope we all know that, because you might not. You might want to know that. There are severe problems with system capacity due to hydraulic overloads caused by surface water entering the system due to heavy rainfall. I mean, we've been lucky of late because we haven't had a great deal of that. There are sewer faults due to old pipework collapses, blockages and leaks. That largely relates to existing housing stock, but the new housing stock will feed into that and it will impact on it. And it's a problem that needs to be fixed and hasn't been addressed in the report. The sewage loading component would arise from 3,200 new homes proposed for Tunbridge alone would add a significant burden to the Tunbridge Wastewater Treatment Works. The addition of this and nearby proposed housing is likely to exceed the existing permit levels. Nowhere in the report does it actually tell you what the limit of the treatment works actually is, historically, now, or in the future. Surface water runoff from possible housing developments will be very significant from all of the information that is available. Site-based SUDs may mitigate some of the problems by delaying the entry of the surface water into the network, but the lack of permeability of green spaces, land, may not prevent the loads predicted from seriously impacting the network. The budget for the Tunbridge Water Development Treatment Works shows that funding for any major expansion of the Tunbridge site is not phased to fit the possible Tunbridge local plan, or it doesn't indicate that it does. And the majority of the funding is aligned to fix the currently known problems, not to develop increased capacity. And the review has highlighted dire ecological and overall pollution problems that exist with the water quality of the River Medway and its tributaries caused by sewage releases and other problems. I think those are reasonable questions, and Southern Water may choose to contest them, but it would be good to know the answer. So moving on to Kent County Council, it won't surprise you to know what my feeling is, that the KCC response is lacking in detail or specificity, and there is a tendency to fall back on the need for detailed investigations to be undertaken in the future. Therefore, the response is not endorsing the proposals in any credible sense, but it does go on to identify a few areas, but not in any great detail. It does seem to be very keen on mineral waste. There's a keen focus on mineral waste, and there is some criticism of the lack of detail in the local plan regarding safeguarded waste management and mineral processing infrastructure. Got no idea if that's true, but that's what they say. Education, they're saying that they are working to a maximum pupil yield with regard to the potential pupil numbers arising from housing developments. However, there's no detail given regarding the numbers to be accommodating and how it would be achieved. There's also no reference to the additional growth near to the boundaries of Tunbridge and Malling, but within the catchment area of the schools within the borough. However, there are references to various local planning groups and the need to mitigate for the proposed development areas. Transport's an interesting one. They say they do refer to the need for an A25 item bypass to relieve the impacts of Borough Green Garden Village, or Borough Green Gardens. However, KCC doesn't appear to be convinced, as I think local people are, that it should be provided before the houses are occupied. As far as other large developments, KCC suggests that further strategic and detailed modelling work would need to be done. I mean, that's a cop-out really, isn't it? There is no indication that KCC have any intention of doing any of this work as part of their remit, or where and by when the modelling should be done. In fact, as we know, the officers here are taking on their own back, and Tunbridge and Malling is doing much of the junction modelling to make sure that we support the evidence base in the local plan ourselves. There's a general assumption that public transport and active travel options will need to be expanded around and between settlements, not an unreasonable set of aspirations, but there's no indication of how and when or if KCC will be the prime mover to achieve this outcome. SUDS. KCC point out that the latest standards have strengthened the requirements with regard to the quantitative rate of runoff and volumes from surface water. For the purposes of this, a standard combined sewer is a sewer intended to receive both foul sewage and runoff. It does not include a sewer intended to receive only foul sewage. KCC have asked that the local plan does ensure that local requirements as a minimum reflect the national standards. But really that, as we know, should fall within the remit of Southern Water to fill us with confidence. So I apologise for rattling on, but it is shorter than it might have been. Thank you. I don't think any of that is necessary for comment. Is for noting. Do you agree, Kelly?
Yeah, I think it would be fair to say that all of the comments that have been made by statutory consultees are being considered and will be discussed, you know, with our partners in terms of how we take that forward. So yeah, I don't have any further comments.
Kelly alluded to the fact of the member invites going into the calendars. We're slightly delayed by a day, but tomorrow your inboxes will be flooded with a number of meeting requests where you're going to be invited to attend the team session similar to we did for the Reg 18 policies. So very soon, like tomorrow, you should get a number of emails inviting you to, I think it's 4 member sessions that we've got to go through the policies, which will effectively update you as to how we've taken into account, obviously, comments received from the Reg 18 and obviously from the Stat Consultee. So quite soon, you will see that in practice, and obviously you'll have the ability to comment, to inform, to alter, if you so wish, in terms of that policy. So you'll be seeing those quite soon. I just wanted to add that because we hope to get it out today, but we were slightly delayed in getting the invites out.
Thank you, James. Councillor Taylor.
Thank you very much, Chairman. I'm still not a member of your committee. I think we all owe Councillor Mehmet a vote of thanks for the work he did on the South East Water. And I mean, that could be a deal breaker in the local plan, and it's now being discussed at government level. And I'm also aware that the leader is in contact with MHCLG about the highways issues, so that's progressing as well. I was very glad to see this sort of precede statutory consultee section in the report, and the Environment Agency and KCC sections did concern me, because issues like sewage, groundwater source protection, flooding, land contamination, mineral safeguarding, waste safeguarding are extremely important issues that have a direct impact on housing delivery, and yet we're miles down the local plan process and we still haven't got any answers. And I think we really need to press and have answers in the same way as we did the Greenbelt studies and settlement hierarchies. This should have been done at the start of the process, not left as an afterthought. It is so crucial. Thank you.
Yeah, I appreciate the concerns that have been raised, Councillor Taylor, on that basis. I think in terms of how we progress, Reg 18, as Kelly previously referred to, is the very start of the process. You'll remember we did have a very early Reg 18, which was, I would say, was very schematic. It was very loose on detail. The next Reg 18 had a lot more detail contained with it. But again, it's the start effectively of that process where you build an evidence base and you start to get information, but you've got Reg 19. So we're going through that sort of evolution process. We're going through that constant updating of both evidence base, discussion with our statutory consultees, informing how our IDP infrastructure delivery plan is going to be developed, progressed. It's a sort of a living document that we should update all the time. So whilst I appreciate members may have concerns, and to a degree, I kind of might expect that, given the Reg 18 stage is an informative stage. It's setting out to the public and to statutory consultees our direction of travel, where we're going, what we're looking at. We're now refining that, getting a lot more detail, a lot more information, and you'll see how that information comes forward when we do the update member briefings, how we've incorporated the comments from the statutory consultees into those policies going forward. So hopefully you will see that in living version in less than a month's time when we do the briefing.
Thank you, Councillor Hood.
Thank you very much, Chairman. I have to say that we asked for information to be sought from South East Water at the very start of this process. At the first regulation 18, we said we wanted that information. The Green Group asked for a water cycle strategy to be implemented as part of this process because we knew that where there were massive shortage issues emerging. So there's a Kent Flood Risk and Water Management Committee that I alluded to at full council. Our member of that committee is the leader of the council. He's only managed to make one of those meetings. I would request that you, Chairman, are already on one of the Southern Water panels. I really think that it would be valuable for you to have a chat with the leader. If he can't make those meetings, for you to be our representative on those committee meetings, because the amount of detail there is really useful. I think you would find it a valuable experience being a member of that committee.
Thank you. Noted. We've had every opportunity to discuss presentation and to make our own points. So this is only for noting. So with your agreement, I'll move on. Thank you. We're at agenda item 11, which is an update from James on the Planning Advisory Service Action Plan, specifically regard to progress on the action plan. James.
Thank you, Chair. Members will note the format. It's in a traffic light system. You previously had this at the last meeting. I wasn't proposing to go through in detail every item on the list. You'll note that where there is an update in bold, that's the update since the previous meeting. So I can go through those individually item by item where there is an update, but I think members would have read the reports and would have seen we are making progress in terms of the action plan, moving those forward. Obviously, one of those sort of key elements is the sort of the training program that we're looking at that is constantly evolving. Obviously, members will be aware at full council the decision was made to progress to a single planning committee, and obviously we're going to make sure the training program sort of reflects that, and we'll be discussing that with the new chairman moving forward. But I can sort of state that progress is being made in terms of the action plan. There are some elements that can't be progressed. That's due to certain issues in terms of with IDOCs and progression of sort of Power BI reports moving forward. So until all the data's in the system, obviously we can't progress that. So items in white on your sheets where you'll notice there has been made no progress, that is for a specific reason, and that's set out in the commentary section, and we'll hope to move those forward in early summer when all the data is in the IDOC's uniform system. So on that, I've got nothing further to add unless members have got specific questions on the update items. Thank you, Chairman.
Any questions on the updates for James? Councillor Hood.
Thank you very much, Chair. The action plan refers on page 69 to work being done with the planning committee chairs and vice chairs. Obviously, because of the decision taken at full council, there's only 2 of those to consult with now. So it's what concerns me is the planning. This whole process has now become so centralised that very few members outside of those people who are listed are involved in that anymore. And it talks about rebuilding member officer relationships, but to strip all planning control or powers from all but 13 members doesn't seem to be the way to go. I've got a question about what happens with we've got this new system, which I fully support, that when applicants come forward, they can meet members and they can talk about design aspects of applications pre-submission. And at Area 1 we've had that, and it worked really well. We were really pleased. How is this going to work in future? Now that members aren't members of the planning committee, is that going to continue in its former guise, or is that going to be set aside?
It will continue. They are programmed in advance, and that's a service that we offered. Cabinet member for planning was key and instrumental in progressing that, and wanted to see something come forward. I see no reason to stop that process. They're already preset, so in the diary they're arranged for monthly, and applicants have the ability to come forward to engage with members on processes, but there are caveats to them in terms of you must have had a pre-app already. So I see no reasons why that process should stop, because it's around early engagement and members having the ability to influence those applications moving forward. So I'd see no reason why that process should stop just because there's been a change to the number of committees. There's still a requirement to progress planning applications. There's still what I would like to see, and hopefully members would like to see, early engagement so you can influence those applications going forward. So I see absolutely no reasons why there'd be a change in process.
I think what Councillor Hood was asking was who would participate, because previously the Area 1 would be the local people to the application. That wouldn't be the case anymore, would it?
It would be members of that committee who would be engaged in that process. So the invites to those applications would go to those members and substitute members of that committee. So they'd be able to, and then obviously any discussions, if there were members outside of that, if you were representing a ward, then you could have a discussion with the person who's in that session. But we have to make sure that we keep it, because it's access to that committee as it was previously to the committees. That invite went out to all members. So I would just see that invite would now go to the individual members of that committee.
Also, just to add, given that many members of the council will now not be members of the planning committee, in many other councils, what tends to happen, particularly if there's a significant application, is that the applicant gets in touch with ward members as a matter of routine and has individual briefings. Now, previously, I know many members have then sought advice from us as officers to say, is this appropriate to do, given that I'm going to be on a planning committee determining the application? And sometimes the advice is, no, it might not be, or please just consider any issues there might be. If you're not on a planning committee anymore, there is absolutely no reason why, as a key stakeholder in your community and a representative of your community, you should not be meeting with a developer. Obviously, if an issue arose and you felt we needed to know about it as planning officers, then as the planning team, please do let us know. But that is certainly, as I say, that's a standard practice in most places that have a single planning committee, that ward members might be approached by a developer or an applicant at their pre-app stage to have that conversation with them separately to the formal planning process.
Does that answer your question, Councillor Hood?
Well, what occurs to me is if we're going to have lots of these arrangements with developers, and we're looking at the scale of development that we anticipate, we're going to spend an awful lot of time meeting applicants at these design appointments, at these briefings, at these workshops. It sounds if you're a member of that, if you're a member of the planning committee, you're going to be very busy.
Point taken. Councillor Oakley, have you still got your hand up?
Thank you. I think my question was answered by Eleanor. Thank you.
Thank you. Any other questions? Okay, well,
Can I make a comment?
you can, Councillor Thornhill.
Just to say, of course, I find developers are increasingly contacting parish councils way before they ever come here to seek what we have to say in general terms. And I appreciate Tunbridge hasn't got a town council, but when it's got one, that will partly resolve that.
And that, engagement, developers are required generally, depending on the size of the application, to submit a statement of community engagement as part of their application. So it's in their interests and almost a requirement that developers need to engage with the community. So that's either through the parish council, through ward members, because they have to show that through the application coming forward. This meeting that effectively the meeting and engagement with the planning committees, they're the decision makers. So at the end of the day, they should be the ones who should be able to have the say in what they want to see coming forward, i.e. in terms of specific design criteria, specific features, and obviously it's the ward members who would then impart into that committee, whoever sits on that committee. So there's a robust discussion around effectively what needs to change as part of those applications. So, there is quite a big, robust process around this, not just effectively the engagement with the planning committee members. It's around engagement on state and community involvement and what that entails, which is, as it says on the tin, engagement with the local community.
Thank you. Well, we've had the discussion. Anita, you've got your hand up again.
I have, because I do think it's really important for members to be able to have input with developers, and I haven't always agreed with fellow members on the committee who were not actually members of the same group. And the planning committee will be politically balanced, obviously in the favour of the ruling group. And I do hope that the training will be robust enough to take into account a subjective view and not a political view of members. Thank you.
Thank you, Councillor Oakley. Noted, and I hope so too. We basically have discussed the action plan. All the updates have been identified and we've had points. So I'll just say that, would you agree to note the contents? Thank you. So moving on, we come to the work programme, which is on page 79 of the documents. I have no additional items for the work programme at this particular moment. Has anyone got any points they wish to raise in that regard? Councillor Davies.
One issue that is raising my concern, I have only on one application which my residents are talking about. The length of legal time that in getting agreements on, for example, biodiversity net gain and S106, associated S106s, and that's put out to contract. We're going out to contract on it. And I think the amount of time that it's taking seems inordinate, and I just wonder if we can, we shouldn't perhaps be looking at that as a committee.
Thank you, Chair. This was covered in the report that went to overview and scrutiny in April about Section 106. There was a specific reference in there to this process. We do acknowledge that the agreements, particularly Section 106 agreements, can take a long time. There are a number of factors in that. We've agreed that there will be a revised monitoring approach. So a monthly list of work will now be reviewed by myself, Adrian, James and Joy as the relevant senior officers to look at any issues and see if there's anywhere that we need to intervene. Obviously, it's a legal process and therefore it's not just our contracted solicitor who is engaged in that. It is also the contracted solicitor of the applicant. You know, sometimes that process runs very smoothly. Sometimes that's another opportunity for them to strengthen their position on particular issues that they might have to deliver. So there are potentially delays from that side as well. But we are looking at ways to improve our monitoring of that. We also put in the report that subject to the position on local government reorganisation and knowing what our grouping's likely to be, once we know that, then we'll engage in a conversation with whoever our new partner organisations are about whether they do that through contract or in-house and whether there are any efficiencies we can draw through that. So it's a live issue and one we're monitoring closely.
Okay.
Yes, I'll take the individual thing up with Eleanor and the team.
Thank you. As I have no other points formally raised for the work programme, the programme stands as is, and I'll move on to urgent items, which I have none. So I have no urgent items and I will close the meeting at 9:45. Thank you for your time.